Hi, everybody. Welcome. It is, I was going to say Monday. Maybe it's Tuesday. Maybe it's Monday. It is Monday. Welcome. This is I Was Supposed to Have a Baby's Talking Away the Taboo Insta Live series. We haven't done this in a little while, so I need you to bear with me as I figure out how to do this again. And Yonina is going to be here in a second. Yonina, you can join. Let me see. I'm going to try to add you, or you'll add yourself. Let's see how it goes here. Let's see. I'm going to try. Instagram Live has changed a little bit since we started, but Yonina should be here in a second. And look, I'm really excited to have this conversation specifically with Yonina Kaufman, who is a licensed clinical social worker, and she is the clinical director of the 8-Time Hug program. And she is really, here she is. She is, look, I mean, I don't have to speak for her because she can speak for herself, and she is incredibly accomplished and wonderful and so good at what she does. But I'm so excited to have this conversation with you because this is the work you do all day long. And this conversation started way back a number of months ago when I was talking to Homi Friedman, who is the director of the Hug program, and we were saying how we don't talk enough about what the grief process looks like, and how it's not just about the day, God forbid, when the baby dies and when you're in the hospital and the week afterwards or the 2 weeks afterwards, that it really goes on and can go on for a long time. So look, you and I were talking earlier, and we were first of all, introduce yourself. Do that first, and then we'll jump right into it. Tell everybody who you are, even though I just sort of did that for you.
Okay, I'm Yonina Kaufman. Hi, everybody. Welcome. Thank you again, Amy, so much for having me here tonight. When I say it's an honor, I think I've expressed to Amy many a time how privileged I feel to have you in my circle, and to know you, and to really be able to be here tonight. It's really just thank you. My name is Yonina Kaufman. Again, I am the clinical coordinator for 8-Time Hug. I work with women and couples who've experienced perinatal and infant loss with 8-Time. In addition, I also have my private practice that supports women and couples who've experienced perinatal and infant loss, perinatal and mood disorders. I give parenting classes, and I am a supervisor of social work interns and social workers going for their clinical licensing. And on the side, I'm a DOE. On the side, my job is I'm a school social worker for the Department of Education. I do that during the day, and then I get to do things like these wonderful moments in the evenings and on the other hours of the day.
Yeah, look, I mean, yes, I we could go on and list your accolades, because like this, you live and breathe this, and this is really, I mean, this is what you do. So I want this to be, you and I talked a little bit before, but I want this to be a discussion that we're having. Look, we have a little bit of an audience here. We want all of you involved, and we want to get your thoughts on what we're going to be sharing, because the grief process, as we all know, and we're going to share a little bit more with you, is one that does not look the same for every person, even if you have exactly the same experience. And we all know that no two experiences are the same, but even if you could say, like, well, you had a loss at 6 weeks and I had a loss at 6 weeks, or you had a full-term stillbirth and I had a full-term stillbirth, even that doesn't make the experience of grieving the same. But we really want to hear from all of you your thoughts about some of the different points that we're going to be bringing up. So Yonina, go ahead. You start us off with, tell all of us the story that you told me a few minutes ago.
Okay, so I am part of, it's going to sound random, but whatever, the other things that I do.
Exactly, because this is the Renaissance woman who does like all things. So yes, continue on and perpetuate that aura about you. Keep going.
I'm part of a Photoshop editing group. I do a lot of Cricut designs. I do a lot of crafting and stuff like that on the side as well. And a woman had posted on the side. A woman had posted a picture of her baby born still, and she had asked if somebody can edit the picture. She has a living child, and she asked, because of the situation right now in terms of visitors, her daughter couldn't come and hold the baby, and they asked if somebody could edit this picture that the daughter is holding this baby. Now, I've been part of this group for a very long time, and people have put requests for anything and everything, okay, to say the least. And a person dies, somebody says, please put wings on this person. So, different, but this particular conversation with a baby that was no longer living, right, a dead baby, sparked a whole conversation within this particular Facebook group about.
And I want to also say, which you told me, but I'm just going to add it.
Yeah.
This is not a specifically Jewish Facebook group. This is not a specifically religiously Jewish Facebook group. This is a general Facebook group.
General, with thousands of people on it. This is not, and nothing to do with religion or anything. And the amount of comments that it sparked, women who were grateful for a woman posting about this baby, the comments about that. The other comments, though, were how triggering, and it did have on the Facebook chat, it did on in the caption saying trigger warning, but it sparked such a conversation about triggers and how upset people were about this particular picture and this request that they actually changed the rules of this particular Facebook group, that people can no longer put pictures of babies in the NICU, people on tubes.
NICU.
Yeah, it's interesting. I just read it, by the way. Yep. Okay. Dead babies. And that was actually it. Things that were deemed as too triggering, and that the pictures had to be posted in the comments, but had to be approved first by the moderators. Now, and I had a lot of thoughts about this, because you saw the difference, and their response, the reason why they did that was that because their caption was, everyone's on their healing journey at different points of their journey. And if they could avoid hurt and pain, then that is what they're asking that everyone agree to.
Right.
And
yeah, keep going.
It really does spark a conversation of what does it mean to be grieving? What does it mean? This woman, this was her grieving journey. This was her, she literally just lost a baby, and putting the baby out there, sharing her loss with this group was part of her journey. And other people felt it was just so hard. And it is hard. It was hard to see this dead baby. It was. And you're like mixed. It's like that. It's like the cognitive dissonance of like, okay, we know the psychological aspects, we do. And this is something I want to just, bring up, the idea of sharing our story. All right, Amy, this is all you do. This is right. Our goal.
All day long.
People talk about their dead babies. People bring it up about their dead babies. On the other hand, it's, how do we be sensitive to those who are on this journey, who are on this grieving journey?
Right. I mean, they're like, this space, the I was supposed to have a baby space, is a safe space to talk about those things, to talk about your babies, to talk about your infertility process, to talk about things that you're grieving and things that you're mourning. The general public, as everyone knows, I wouldn't even say the general public. Sometimes it's even people in your own life, people that you're close to. Sometimes it's your family members. Sometimes it's even your spouses, are not necessarily that safe space. You don't feel comfortable. They've said comments that make you feel uncomfortable and make you feel like your grieving is inappropriate, not warranted, not necessary, et cetera, et cetera. And so it's, I think, like, I'm guessing that some of the comments were about why are we talking about this here? This is supposed to be a safe space. This is a Photoshop group. I don't want to think about dead babies here. I thought this was safe.
Right. It was a very mixed emotional, right. Women who there were comments. I mean, I did actually go through some of the comments, just as because I deal with grief for so much, so much. And it wasn't a specified type of group, right? So here this woman is putting it out there. And the feedback was, and I guess it was such an important conversation that they did feel that this isn't a safe space for this type of picture editing. This isn't.
Right.
People don't feel safe. They want to feel safe when they come here. And because it's such a big trigger, there were 600, just by the way, 600 people who agreed to their new rules.
Wow.
Because this is where they want to go just for
right.
photo editing.
Right. And I'll say that there's a different Facebook group that I'm a part of that is a Jewish nonprofit Facebook group. And there was just a post today where people were talking about, shul, synagogue announcements and mazel tovs, and how triggering that is for some portion of the population, like people who don't have children, people who are not getting married, people who their kids are not at the point where they're, even thinking about marriage, or not. Like there are a million reasons why someone may not be, quote, having a mazel tov. And so, like, does that mean that we should take away all of the, fabulous announcements that go on in the community setting? I'm not sure, but it's just a very, it's also a similar conversation to the one that we had a while ago around the start of school, right? It's should I be posting my back to school pictures? Should I not be posting my back to school pictures because I want to be sensitive to others? Should I be, or conversations that we've had a lot of times here also, it's now that I'm pregnant, right? And specifically in this space, like for people who have struggled and, or continue to struggle, now that I'm pregnant, does that mean that I can't tell people that I can't announce publicly that I'm pregnant, that I can't get all of that, endorphin rush from seeing a million likes when I, post my baby bump? Like, what does that mean? Like, am I allowed or not allowed? Right? Like, what are your thoughts?
So, I was telling you before, right? This woman, I'm part of another, I'm on a secular, a non-Jewish specific pregnancy loss group. And a woman went on a rant about how she's so angry at this particular friend for announcing her, saying how happy she is to be a mother. And here this woman is not a mother, and she had 3 losses. And it was interesting, again, it was interesting to see the responses from, remember, that's a specific pregnancy loss group, right, where, people who have experienced loss, right? And they understand and have empathy for people who are going through their journey, in whatever part of the journey that they're on. And it was interesting to see different responses, right? So a woman responded, I went through 3-4 losses, and then I had my rainbow baby. How does it balance out in terms of being sensitive to the people who had their losses, to the fact that I'm now celebrating my rainbow baby? And it comes, again, to me, it just boils down to empathy, right? And it's sensitivity. It's, okay, I'm making this announcement because I'm happy for what I'm going through, and it comes with what cost? Who's going to be seeing this? What am I sharing? How am I sharing it? Does this bring me joy to be able to share this with the world? And there are people who responded of saying, I love seeing these stories because it gives me hope, because it gives me something that holds on to and says, hey, look, she has this. I hope one day I can experience the same joy that she has as well. I went to a bris today. I did. I went to a beautiful bris today of a woman who had 3 losses before this beautiful rainbow baby. And her response was that she had shown up at my door one night, 10 months ago, 11 months, whatever it was, with tears rolling down. It was a Friday night. Says, Yonina, can we go for a walk? And tears rolling down her face. And she says to me today, she says, I was waiting for this neshama to come down. And you look at her and you say, yeah, she experienced so much loss. And
Right.
yet she is in the journey where she can look at this baby and hold space for both experiences.
Right. Right. So, I mean, I guess really the question through all of it is like, what for, we all can understand why seeing a picture of a dead baby, or why seeing a pregnancy announcement, or why going to a risk, like why that can be triggering for someone who's had loss, right? We all know that. It's not rocket science. The question is what's normal, right? Like what's normal? What does the grieving process look like? Until when should that still stay uncomfortable? Like what do you see from people? What do you tell people, like when you're counseling them? Like, how do you advise them?
Okay, so I have a story that I tell almost every time I give a phone support, and the story is as follows. I get a call from a woman who's very upset, and she says to me, what do I do? I have a sister. I made a chasana,
The wedding.
and I have a sister who did not show up to my wedding. Why? Because she had a baby around the same time that my daughter was born, and she found it just too difficult, and I'm so upset with her. What do I say to her? And I said, okay, I'm going to hold space for you. I'm sure it was very disappointing. I'm sure it's upsetting that your sister couldn't join. I said, but I'm wondering if we can actually look at it from another angle, right? We're going to maybe reframe it to the idea of your sister was hurting so much 21 years later that she really felt like she just couldn't be there. And the woman actually called back and said, I want you to know it totally changed my entire perspective about her loss, right? Why? Because she had a baby. How the sister grieved, we don't know, right? Who she was able to talk to as a support system, I don't know. We're going back 20 years ago.
Right.
But 20 years later, it was such a difficult thing for her that she decided to create those boundaries, as difficult as it was. It came with consequences, those boundaries, right? She had family members upset with her. People were disappointed in her. But
people expected her to be there and not, right? Even beyond the immediate family, like they're like, where is she? What happens? Right.
Right. They expected her. And yet internally, right, it was so important. The grief was so there still, right? It was such a trigger for her that she truly felt, and it sparked a conversation. This woman really did take it, and I give this woman a lot of credit because it's not easy to see from another perspective. It's not necessarily, it's a journey. That's a journey in itself, right?
Totally.
And it created a conversation between the family, and it actually united a little bit these siblings because they were able to actually hear her story and be able to respect how 20 years later, it's still with her. It's still there. And that's what I say to clients, and that's how I work with. And I use the story a lot because some people, they go through grief, they go through loss, and they go through a healing journey, right? They're able to find their support system. They have a strong support system. They have people that are able to sit there with them. They're able to have the space to go through this journey, and they're able to navigate, right? And we can call the grieving journey like an ocean, right? We're swimming through it, right? There's no timeline. There's no time constraints.
The waves keep crashing. The waves keep crashing. They keep coming. They keep coming.
Right? And they can pick you up. Exactly. And then some people, the waves are a lot stronger, and it keeps you down a little bit, and it keeps you down a lot longer. And the bottom line is we have to understand grief, right? We have to understand how, thank God, we are evolving as a community. And I'm not even just talking about the Jewish world. Yep. I'm really not. I want you to know I've been giving grief trainings. I've been taking grief trainings for years now. And I was sitting with my social work interns and my colleague last year, right before Corona, actually, last year. And a parent had died, whatever the story was. And my client and my colleague, this is a social worker, says to the social work intern, oh, so let's just go through the 5 stages of grief. I'm like, wait. Now remember.
Okay, well, hold on. Does everybody know why we're making these? Like, I want to make sure, like, does everybody know why Yonina and I are making faces? Like, right. Why are we making faces? Go ahead, tell them.
Making faces because we have so evolved since the 1960s and the 1970s, where Elizabeth Kubler-Ross had come up with these 5 stages, to the point that I, thank God, finally took a course a couple of weeks ago with Claire Bidwell Smith and David Kessler, who actually wrote his book with Elizabeth Kubler-Ross, finally saying that there are no stages in grief. And I was like, you don't understand. There were about 25,000 clinicians on this training. And I was just like, thank you. I was like, oh my gosh, this is exciting. Because even to this day, there are people who are still creating this like platform of trainings where grief has to be in stages, a little box.
In boxes, right.
And it was so gratifying, I have to say. I do have to say that it was so gratifying to finally hear it. And it was so disappointing to hear a colleague, because she had recently taken a training. And that means that people are still training about these stages. And what do these stages do? It puts people in a box, right? And if they don't fit that box, if they're not grieving the way this process, as they call it, right, then it becomes a shame. There's something wrong with me. And that's why I'm making these faces, because we know that this no longer pertains to the grieving journey. Yes, there are parts of anger. There are parts of depression. There are parts of anxiety that come up. There are parts of acceptance that people do go through, but it's not linear.
Yes. And also very much like the denial piece of like
and denial.
I remember just the one piece for me, I mean, I remember like feeling all of those things, and sometimes even all in the same like hour. But I remember this like denial piece of like waking up in the morning and thinking, right, like, you know, like you can't see me, but I'm patting my stomach, like, you know, like, right, like in that first moment, like I'm still pregnant. And then all of a sudden it like comes back, like that denial that sometimes like you just forget. Yeah.
And the denial piece is very important, by the way, right? Denial helps us. It does. It helps us navigate the trauma, right? It helps
very
us down parts of our brains that just can't handle that right now, right? And we're not saying that we're not saying that these concepts don't exist. I want to change from stages, because we're not using stages anymore, right? We're using the word concepts, right? There is anger. There is depression. There is denial. There is, I'm going to use the word instead, I'm going to use the word anxiety instead of bargaining, because that was one of the words that they used. I'm going to use that, right? We're anxious. We're nervous. We're not sure what things are going to be. And there's a concept of acceptance for some, right? Through their journey. But there's no timeline to this, right? And that's why I have people telling me years later, they still think about their babies. They still talk about their babies. You know, people navigate differently. People mourn differently, right? And especially when it comes to baby loss. And I'm going to use that as a specific, right? Baby loss, there's no Shiva. There's no acknowledgement necessarily, right? I think I saw one of your posts. Somebody posted something actually of like, how do you check in with a person who's grieving, right? It's like the immediate loss, right? Everyone like comes in. That's how we function. It's our human nature to want to do and want to help. And then it's what happens weeks later, right? So the perception is that, right, society has sort of created this. And again, thank God for these trainings that we're trying to, and these conversations that we're trying to say, no. It's not, you're fine now because you've had a few weeks off to sort of like get yourself together.
Deal with it, whatever that means, right?
Pick yourself up, brush yourself off,
right.
move on, you're fine. I mean, we get it all the time. It's not that. It's how do you now take care of yourself, right? And I don't know who I'm talking to. I know there's a lot of people here. So it's those who are grieving, those who are on their journey. There are friends who are on this. There are clinicians maybe on this,
Yep.
And it's a conversation of how to support and how to hold space and how to empathize with those who are on this grieving journey and normalize. I think that's another word of just all the thoughts and feelings that they may be coming up. You know how many times I get calls of like, is it normal that I'm still thinking this way? Is it normal I'm still feeling this way?
Right.
And by the way, I'll get calls like this about my baby died a week ago.
Yeah. Right. It's that, and it's also the, like, is it normal that, like, yes, a week ago, because we all think, okay, like, I finished with my meals and like I'm not maybe bleeding anymore, and so like I should be done with this, like I should be, because we, even though we've evolved a little bit off of the, like, the stages and the boxes, we as a society still, because there are no outward expressions of any support for grief after that initial stage, everyone just assumes like, oh, you're fine afterwards. It's only when you've experienced grief yourself, and it's general grief, if God forbid you've lost a parent or you've lost someone close to you, everybody knows you don't just wake up one day and you're like, oh yeah, I'm good now, like everything's fine. Like, and it's the same way with a baby. It's the same way with a baby.
Yeah. It was actually interesting. Somebody had written, there was a whole thing about, checking in. Like, how do you check in with friends who have experienced loss? And someone responded, actually, she was like, I don't want it to be a fake check-in. Like, if you're really sincere about how I'm doing, like, pick up the phone, call me and see how I'm doing. And it's interesting how things are evolving in terms of how we support. And it's fascinating how we work in terms of the initial loss, right? We want to help. What can we do? And then it's, okay, now 2 months later, 3 months later, you're still grieving, right? You're still mourning. You're still in the journey, and everyone has moved on. And I think it goes back to our initial conversation of how does it work in terms of holding space for everyone's journey and everyone going through different aspects of their own lives.
Definitely. And I think also, like, what I also wanted you to touch on is, like, so now we sort of established the premise that there are no stages, and you're going to grieve and you're going to think about your baby for a long time, and for every person that's different. And you may, like, there may be a few days where you're not thinking about the baby, and then it's coming back to you, and on specific dates that are meaningful, it's going to be flooding back, just like your story about the woman 20 years later who couldn't go to this wedding. But what happens is, and this is like one of the things I really wanted to ask you, right, is that family members and friends are like, why are they still doing that? Like, why are they still X? Why are they still, like, why are they still? And so the question I have is, when is it, like, what people are worried about is they're like, oh, they're grieving too much. Oh, they're too depressed. Oh, they're thinking about it too much. So I guess, like, for everyone out there who's like, I don't, like, where's that line in the sand of it's too much or it's normal grieving and it's okay? Like, how do you know?
So when a person wants to harm themselves, right? I'm going to make that as the extreme of, once a person says, I want to hurt myself because I'm so depressed, that's when we say that's enough. Right? That's enough, right? Anything before that, I have to say, we sort of are starting, and again, thank God we're doing these kinds of conversations. We're actually normalizing, right? I have clients who will call me and say, I was walking in the store and I saw a woman pushing a baby. It's so not normal, but I started crying. Really, what's not normal about that, right? 20 years later, I'm saying that a woman couldn't even go to a niece's wedding. And here we're normalizing that, right? So the question is, so the word normal, right? So again,
I use that word specifically because, yes.
got you. I'm holding, right?
Yeah.
So again, I want to, I have clients, I do this as a private practice, because different people, different women are on their different journey of how they want to navigate the journey, right? And coming to a therapist, right? I want to normalize that as well. I need someone to just listen to me, right? And I get to be in the seat of saying, okay, that makes sense, right? And we work through that journey of sort of forgiving ourselves, right? Holding space for our emotions, being able to actually sit with emotions, right? The reason why there are so many people who say, is it normal, right? Or why is she doing this for so long? Is because let's really delve deep into that one. Let's unpack that one. Are we really comfortable with emotions?
All true.
Right? What does it really mean to grieve? What does it really mean to be hurting? Right? We're in a society and a culture. I'm not saying this again. I don't want to make this, culture specific,
Right.
but on a global level, right? We are shifting. Thank God, mental health is shifting. Where we're acknowledging. It used to be. I had this. I'll tell you honestly. I had a woman in my community whose baby died from SIDS, and I was helping her navigate, and I was talking to a colleague of mine, a clinician, who says to me, is she constantly crying? Now we're talking about a month later, whatever it is. Right. Okay. And I said, yeah, she's constantly crying. We're working through it, whatever the story is. And she says to me, she needs to go on medication.
Yeah.
Mm-hmm. Yeah. And so that's why you asked me, right? What's the term? Right. If she expressed that she needed to hurt herself, then I say, okay, we need to take this somewhere, obviously for mental health and medical intervention, right? Does that mean that her crying was bad? It was so crazy. It was so fascinating to me to hear a colleague say after a month after a loss of a child that her tears were an indication of a mental health medical issue. Wow. And we're evolving. Thank God. We're understanding mental health. We're understanding grief. And I think that also does help us understand that tears are just as much of the grieving journey, right? And pain and hurt and anger and frustration and all these feelings that don't feel good, right? Nobody wants to sit with emotions. Nobody wants to actually explore them and allow them to be, right? We want to push the idea of more positive emotions, happiness and joy. And we want to say, no, I'm okay. I'm really doing okay. And then we squash down all of these emotions that don't feel so good. We push them under the carpet, right? We're breaking off from this, but it's still out there, right? Because the comments still come in. I still get calls from Karen saying it's not normal. What is she doing? Why is she still laying in bed? Right? And we're still working, and we're working and breaking these stereotypes of what this really means, that says, no, this is okay. This is what she has to do to take care of herself right now. This is what she has to do to go through this grieving journey. And if it involves getting a therapist, again, I'm all about therapy. I do this for a living. This population, it's a special niche, and it's a special population of women and couples who have experienced a loss and grief. And it's a journey, and I'm privileged to be there with them on this journey. But their journey is theirs. Their journey is part of who they are. And no, they're not the same person they were before the journey, before this loss. They're a different person. They're going through and challenges and navigating these challenges. And I get to be there with them to watch it evolve and watch them learn how to actually process these emotions and navigate these emotions. And we're just one person at a time. We're breaking the stereotype of what it means to actually sit with feelings and actually acknowledge that these are okay.
Definitely. And also I'll add, which I know we've talked about, and I've talked about a lot as well. We also know that when you sublimate your emotions, when you're having these very strong emotions of grief and these other pieces, if you squash them down and you don't give them space, if you don't allow yourself to feel them, then what happens is that they they'll come out at the most inopportune times later on. And also sometimes they manifest in other areas of your life, in other physical ways. You may start having headaches, stomach aches, not able to concentrate, anxiety, depression. Like there are all sorts of ways that, we know this. There is a lot of research out there that says this, that when you don't allow yourself to have the natural emotions that one would have after losing a child, after losing a baby, like when you're squashing that, it can have negative effects later on, and even in those moments and in those days, physically. So it's we are now like this olden sort of olden age concept of like, no, everything is fine, and we're just going to smile, and we're just going to say everything is good, and we're back together, and we're just going to get pregnant again because that's going to fix all our problems. Like, okay, for some people that actually might be what they want, and that's okay, and we support them through that, but it doesn't mean that they're not also allowed to grieve, and that's the only way that someone can, quote, get through a grieving process.
I have a great story, actually. I was talking to a woman, whatever the story, whatever her journey is, it was literally had nothing to do with pregnancy loss. And we were just talking about loss and grief and different, aspects of grief. And this is a cancer patient, right? And this had nothing to do with anything about pregnancy loss originally, right? And she says to me, I said, our bodies are psychosomatic, meaning we do, our bodies do respond. Our brains are a very powerful organ, and our bodies do respond to emotions that aren't necessarily expressed. And she says, that's so interesting. I have such terrible back pain, and I've gone to so many different therapists, so many different physical therapists and back specialists. Maybe I can explore this. Okay. We talked about it fine. A couple of weeks later, she calls me and she says, you're not going to believe this. She says, I have been going to a physical therapist who tells me all the time, look how your back, it's so tense. It's so bad. This is where it is. And she's like, there's something going on. She said, the second I start, and she says to me, I just want you to know, I had a baby that died. I had a stillborn, many years ago. I think she said 10 years ago. She said, I never talked about it. My family pretended it didn't happen. Whatever her story is, I don't even want to go into details of that.
Right.
It was never addressed. It was never talked about. And the second I started talking about my dead baby, she said, I went back to physical therapy. And the physical therapist says to me, she says, I see something's different. She says, things are loosening up, and I feel it. I feel things are loosening up. And I mean, again, to be part of that, to hear that, and to know that this is her journey. And now it became like a whole thing. She's been talking about it, exploring it, working through her loss. And that's another part of her grief journey. But it's fascinating to see how actualized it was.
Wow.
On a physical level.
Wow. Look, I mean, I can even speak for myself personally, that having nothing to do with grief per se. I mean, I had many, many pregnancy losses, but I'll just even speak personally, just in terms of the last number of, 15 months, through the pandemic. Like, I was carrying a lot of anxiety and just like dealing with my family and dealing with, the world falling apart around us and 1,000 other things. And for me, I carry my stress in my stomach. And so I was having, I always, my stomach gets irritated and I have lots of symptoms. And I had a tremendous number of symptoms in the last year and year plus. And I knew exactly what it was from. I knew exactly what it was, but it's just another reminder. We carry our emotions in our bodies in different ways. So absolutely.
Yeah.
Absolutely. Yonina, as we're coming, I try not to have these go on too long because I want to keep them in sort of bite-sized chunks for people to be able to digest and listen to. Thoughts, parting thoughts for people who are going through this now, for people who are, in the midst of the grief process, for the people who are supporting them. I mean, what do we say to them? How do we hold them? How do we, I mean, now I'm telling you, give me an answer, you know, that would be a 12,000 year lecture in 5 seconds. So try to do that for me. Go ahead. See what you can do with that.
Okay, I'm going to break it up quickly in my head about who I'm addressing. Okay. For the people who are on the journey, I use the word journey. I actually had a client that says to me, I don't like the word journey. I said, okay, it's your story. This is your story. These are chapters of your story. Be kind to yourself. Okay. Having that self-compassion, acknowledging whatever emotions that are coming up, giving yourself permission to feel. Again, we use the word normal. It's to normalize all of these feelings, all of these emotions, at whatever point you are, it can, months later, days later, weeks later, years later. These emotions are real. Loss is real. Grief is real. We are, again, I said 25,000 people joined a conference on grief, on the topic of grief. Okay. And if I told you it was a 3-day conference, okay, because we are, thank God, evolving in terms of understanding how important how important it is to grieve, right? And how valuable and how valid it is for the need to grieve. And I just want to just emphasize that grieving is part of human nature. It's part of our need to express, to explore the love that we held for the loss. And grief, by the way, is so big. The word grief in so many different areas of our lives. So the word grief it's a big concept. For those who are supporting, those who are grieving, empathy, right? When we hear it and understand it, right, it allows us to hold space and to empathize, right? And so when your friends say some crazy things that just to you sound really like, really? That doesn't, really? Is that what it means? When you're able to say, hold on, she's hurting. Hold on, he's hurting. Hold on, they're hurting. And I use the word hurting. I want to make sure I emphasize the word hurting, right? Because they're not broken and they don't need to be fixed, right? They need to be held. They need to be seen with compassion. They need to be held, their space with empathy, with that friendship and not just friendship, right? We're talking to family members, right? Being able to understand and be able to validate, right? All these big words, it's real. It's real. And I could tell you the amount of people who have been able to get through this journey, right, is because they had that support, is because they have I was supposed to have a baby, right? Not everyone has the family support. Not everyone has, like you said, not everyone has that safe space to go to, right? But because we've created a culture where Instagram pages like this, Facebook pages like this, where it is a safe space. I can't begin to tell you, I mean, Amy knows this, but I have clients, right, who have come to me because of Amy, right? Because they are joining all of her support groups. They're joining her Facebook lives. They're joining her. They follow her pages every day. And they have found that to be comforting. They have found that to be supportive. And you look at it and you say, thank God for people like I was supposed to have a baby. And thank God for Amy. We too have to be that people.
No.
But, no, yeah, you know.
No, I know.
Because you had to create this. You had to, because people, like we talked about in the beginning, they didn't feel safe. And here you created it. So Amy, thanks to you.
Look, this was what I created, what I wanted, what I wanted when I was, knee deep in the trenches, when I was crying in my bed, for days and days and days and days and days. Like, this is what I wanted that I didn't have. And I say, I mean, it's always so, like, it feels kind of heretical, but I always say, like, thank God for Instagram, because thank God for social media, because it creates the forum where people can come together in a way that feels comfortable for them. Like, you can either be yourself, or you can be anonymous, or you can just passively absorb. But you're still, at the end of the day, getting the benefit of the community, of the validation of all those pieces. So there's a lot to be grateful for. And the fact that I have, like, let's like bring it full circle. The fact that when people come and they say, I need more help, and I say, go to Yonina.
Yeah, thank you.
That's what happens.
I want to bring up, just as a quick, I could say, as I work, I'm the clinical coordinator for A-Time, and all these organizations working together with you. Your summit, it brought us all together. There's a lot of help that is needed in our community. Our community alone. Can you imagine just globally?
Correct.
And social media in and of itself has created a way for people to access. We have been able to just technology alone, right, has given us, and to all those who are out there, we're here. I think that's it's not a pitch. It's more of just saying we're here. We're here to support. We get it. We understand. We're here with you. And if you need anything, please don't hesitate to reach out, because we are here. And again, I just want to say thank you.
Look, it's my pleasure. It's Yonina. Thank you for, there's one thing to talk about it and to have posts and to have content, but there's another thing to speak with someone who's in the trenches on a daily basis and having these conversations and working with these families who are going through it. And so that's, I really wanted you to be here so that you could talk about some of these things in a really beautiful and meaningful way, because this is the work you do all day long. So thank you, thank you, thank you.
Thank you.
All right, everybody. Good night. I will tag Yonina so you know where to find her if you want to ask her any other questions, if you want to reach out to A-Time Hug, and help ask them for any of their services and their programming, which is also, absolutely incredible. But this is what we do. We are here to support you, and all grieving is okay. And we are here to hold you and to empathize with you and just to normalize it. That's the bottom line. That's the bottom line. Okay, everybody. Good night. Yonina, thank you so much.
Thank you.
Thank you. Good night.